Professor Bacha.
I'm on. Yes, Philip.
I'm sorry for what happened. The machine they are using had an issue, so they had to change it to another machine. So they were not able to play your BIOS, but they are telling me we are starting in the next 5 minutes. And again, I've seen they're asking yet we've not allowed the attendees yet, but as soon as we start, they will start allowing the others to join into the webinar.
So are they going to play the BIOS or it will not work?
No, I will have to start again, introduce, we'll have to do the whole reintroduction again, as soon as they give me a cue, and then they will play the BIOS when we are ready.
Oh, that's fine, that's fine.
Okay. I see the other panelists have taken a walk for a minute. Let's wait for them.
Just a quick question, Philip. Quick question. Do we need to keep our videos on throughout?
You don't have to keep it throughout,
Yes.
as long as you're not the one
Speaking.
Speaking. You can keep yours off.
Okay.
But
Okay.
anytime you want to contribute or it's your turn to speak, you have to put it on.
Okay. Thank you.
But I'll keep mine on all the time.
Okay.
Okay.
I guess these were part of the rules that you had mentioned that we would establish at the beginning.
Sorry?
You had mentioned some rules or operational guidelines.
The house rules were just to check our voice if it's okay. Like the question you've asked is something maybe it was an oversight from my end. I should have mentioned that earlier on, whereby you don't have to keep your video on all the time. Only when you're speaking, you put it on, and then you put it off. If you want to contribute, when it's your time to contribute, when you're done, please tell me. I'm handing it over to you, Philip, so that we know you finished. So that if anyone wanted to add anything, they could add it at that particular point. I think those are a few of the ground rules.
Okay.
Well, I'm now told we are ready. I'm now told we are ready, but I cannot see the other panelists. Don't know whether Dr. Hiva. I can't see Dr. Hiva on his desk. John, can you put on your, if you can hear me, can you put on your camera? Can see Dr. Annie.
Okay. Let me just try and call Hiver, see if he's available.
Okay, thank you. Annie, I know you had asked about allowing in other participants, attendees. What we have agreed is the moment we start is when we start allowing them in, in the next few minutes.
Yeah, they are getting a bit impatient and they are harassing us.
No, we are starting now.
They've the problem actually. They think it is them with the problem or the link.
No, this one has been, today we've really had a very big issue. It's usually not like this.
No, just.
I need Dr. Hiva is back. John? John?
Yes,
I think
I'm
John
here.
is not yet. Oh, you're here. Okay. Then I think we can start. So I'll take this opportunity again to welcome all of you to this webinar by the AU-IBA team in partnership with the Standard Group. Today we are having, our conversation is on animal health and what AU-IBA is doing on improving animal health in the continent. And today I have a panel of 5, and I will take this opportunity to, at least for us to listen or to see their bios before we begin this conversation. Please, let's play our their bios, please.
Professor James Kihangawa Bacha, a Kenyan veterinarian, obtained a PhD and a Bachelor's of Veterinary Medicine from the University of Nairobi, a Master's of Science degree from Free University in Brussels. Professor James Wabacha is currently the Senior Animal Health Specialist at the Inter-African Bureau for Animal Resources, AU-IBA. He is currently the coordinator of the Life to Africa project. Prior to Life to Africa, he managed several livestock development projects, including the Somali Livestock Certification Project and the USAID-funded project from the University Standard Methods and Procedures in Animal Health, aimed at promoting coordination and harmonization of disease control measures, senior animal trade-related tasks in the Greater Horn of Animal Resources. In these responsibilities, he has been involved in project design, provision of project direction and management and coordination among various actors. Development project Wabacha is also the secretary of the International Scientific Council of Trypanosomiasis Research and Control at AU-IBA. Prior to AU-IBA, he worked at the University of Nairobi under the Faculty of Veterinary Medicine, rising through the ranks to associate professor, where he teaches clinical and food animal production medicine, including experience in administrative and academic head of the Department of Clinical Studies, Faculty of Veterinary Medicine. Dr. Henry Wamwai is a Kenyan veterinarian with a Bachelor's of Veterinary Medicine degree from the University of Nairobi, a Master's degree in Veterinary Microbiology from the University of Surrey in the UK, and a PhD in Veterinary Virology conferred by the University of Hertfordshire in the UK. In 2009, he was employed by the African Union Inter-African Bureau for Animal Resource (AU-IBA) to initially coordinate its initiatives in Somalia from the year 2009 to 2016. He then coordinated a regional project covering 8 IGAD member states aimed at improving the surveillance for animal disease in support of trade in livestock and livestock products. In recent years, he has led the AU-IBA's initiative to support all African Union member states to develop and implement strategies for the control and eradication of pesticide death ruminants, also known as PPR, in line with the Pan-African and global strategies for the eradication of the disease by 2030. Dr. Wamai is currently working as a consultant for AU-IBA. Prior to AU-IBA, Dr. Wamai worked as a research scientist at the Kenya Agricultural Research Institute, currently known as KALRO, for 20 years, carrying out research on some priority transboundary animal diseases. In 2003, he joined Terra Nova, an NGO working in Somalia, where he led a series of development projects that aimed to re-establish and improve the veterinary service in that country following the collapse in 1990. Mr. John Opong Oto is the Food Safety Officer with AU-IBA. John is the coordinator of the Standards and Trade Secretariats for the Animal Health and Food Safety Officer at the African Youth in Livestock Fisheries and Aquaculture Incubation Network Secretariat. His portfolio at AU-IBA also covers antimicrobial resistance issues, and the coordinator of the African Youth in Livestock Fisheries and Aquaculture Incubators Network. Prior to joining AU-IBA, Mr. Opong Otoa was the Codex Alimentarius Manager at the Ghana Standards Authority for several years. John has a Master's of Law and a Master's in Food Quality Management. Dr. Annie Lewa is an animal health expert with a PhD in socioeconomics. She is currently the AU-IBA Senior Programs and Project Officer. She joined AU-IBA 15 years ago, initially as an animal health expert for the Somalia Ecosystem Rinderpest Eradication Coordination Unit. She was later promoted to the position of coordinator, Regional Animal Health Center in East Africa. A center established to collaborate with FAO is an OIE to oversee control of eradication of avian flu in the region. Dr. Lewa played a key role and supported the development of major continental strategies, among them the Animal Health Strategy for Africa and the Animal Welfare Strategy for Africa. She is also the coordinator of AU-IBA committee that is in charge of the biannual publication of the State of Animal Health in Africa. Dr. Hiva Bosini is the Senior Animal Health Officer at AU-IBA. For 10 years, he has coordinated several key continental animal health programs. Some examples include coordination of the support programs for National Action Plan for Fight Against Avian and Human Flu for Djibouti, Burundi, and the Central African states. Coordination of PPR Continental Strategy and Continental Program Development since 2013 in close partnership with FAO, IAEA, ILRI, REX, MS, OIE, and African Swine Fever Regional Control Strategy Development Coordinator in close partnership with FAO, ILRI, and OIE. Dr. Hiva's portfolio also includes the coordination of animal welfare activities on the continent in partnership with World Animal Protection, African Network for Animal Welfare, the Brook, Donkey Sanctuary, World Animal Protection, OIE, FAO, REX, and the African member states. Additionally, he is involved in the collection, collation, and the dissemination of information on all aspects of animal health in Africa. Professor James Kihangawa Bacha
well, those are our panelists for today. The lady and gentlemen, you've had their bios and how they've been able to, some of the projects they've been able to lead in the animal health department at AU IBA. And maybe to start, because we've already wasted a lot of time and we are trying to, let's not waste more. Let me start with Professor James Bacha. And my question to you, Professor, will be kindly introduce to us who AU IBA is, and briefly tell us how it carries out its mandate, its partnership, and how this ties to the Agenda 2063.
Thank you, Philip, and thank you for inviting us to this webinar. I'll talk briefly about AU IBA, but before I talk about AU IBA, I just want to highlight the significance, the importance of animal resources in our continent as far as food and nutrition security is concerned, employing a lot of people in the animal resources value chain, and its major contribution to our economies as a continent. And with that context, then I can talk about African Union Inter-African Bureau for Animal Resources, or AU IBA, which really was established way back in 1951 to address issues to do with animal health. Then it was established to address a very serious and devastating disease called Rabies, which was eradicated in 2011. And since then, we have grown to what we are today and dealing with all aspects of animal resources development in our continent. So AU IBA is a technical office of the African Union Commission in charge of supporting the African Union member states to address challenges and opportunities in the animal resources sector. Given where we sit at the African Union, we do this by supporting coordination of programs and activities to do with animal resources in the continent. And also, we are heavily involved in working with the member states and regional economic communities in coordinating and harmonizing both strategies, policies, and registrations that are relevant to animal resources development in our continent. And we'll be talking much later to see how then we address such issues. It is important to note that as a continental body in charge of development of animal resources, AU IBA is very strong in the area of advocacy to enhance investments in animal resources sector. And this is really in line with the desire of our political leaders in the continent to enhance budget allocation from their national budgets. As you know, there is that commitment we call the Maputo decision that aims to enhance this contribution to agriculture to about 10%. And as AU IBA, a livestock body, we advocate for enhanced allocation of this budget to the animal resources sector. This is important to us because over the years, investments in these sectors has been low. Therefore, as a livestock body, we advocate for enhanced investments so that we can spur the development of this very important sector in our continent. AU IBA also, as a continental body, is also very strong in the area of getting together the African Union member states to have a common voice when it comes to global and regional negotiations to do with animal resources. Especially, we are very strong in the area of facilitating a common voice when we are setting international standards to do with animal health and in food safety. And I think this forum will allow us to elaborate more on these particular issues. So Philip, that is AU IBA. It's an old organization, and it continues to serve our member states in the area of livestock development and its sustainable utilization in order to support food and nutrition security and well-being of our people in the continent. Up to you, Philip.
Thank you very much, Professor James Bacha. But my question, I'll want to ask you one more question on the same. You've talked about the things that AU-IBA is doing, especially in improving animal health in the continent. But I was hoping you'll also tell us a little bit, why is this important? Why are animals important in this continent? That we need to have this conversation.
Thank you, Philip. I started by really trying to highlight the importance of this sector. It's quite important, and I can emphasize on this because that is the context under which we operate. And I think this discussion with our participants, we really need to dialogue on this. So this particular sector, the animal resources sector, is so critical for our continent. As I said before, we've got about 350 million people in the continent whose life depend on this sector. So you are talking about, if you talk about poverty alleviation, if you are talking about nutrition security, you can see the number that is engaged in this sector. And therefore, it's a sector then we need to invest more so that we can also get this big, huge number of people out of poverty. I also said, if you look at the contribution of this particular sector to the national economies, it's huge. You are talking about a contribution between 30 to almost 80% to the agricultural GDP, depending on the country you are talking about. Yeah. So you are talking about a sector whose contribution to our national development is huge. You look also at a sector where you are talking about issues of health. For us to sustain productivity, for us to sustain trade, there are issues of health. And we'll be talking later about the association between animal health, human health, and the environment. And therefore, it's an important sector to discuss and deal with if we have also to address other areas of socio-economic development, including the public health, including environmental sustainability. So really, this is a huge sector, and therefore, there is a business case for us to invest in this sector and for us to have really serious dialogue with the policymakers and other stakeholders on how we can sustainably develop this sector for the benefit of the African continent. Up to you, Philip.
Thank you very much, Professor. I don't know if the other panelists have anything to add to what Professor Bacha has already told us about AU-IBA and the strategies they've been doing.
If I may, Philip, this is Henry Wamwai.
Please, Henry.
Yeah, not so much about the strategies, but about the contribution of animal resources on the continent. The Professor Bacha mentioned the number of people on the continent that depend either directly or indirectly on animal resources. And if you look at, for instance, the IGAD region alone, which is largely arid and semi-arid, and therefore has very little area available for arable agricultural production, animals are perhaps the best way to utilize the vast rangelands and the arid and semi-arid areas of this region. And this also applies for the Sahel region in Western and Central Africa. And therefore, they play a very big role in sustaining these ecosystems and utilizing them for human well-being. Animals also provide very rich sources of nutrients, especially for children and the sick and elderly, which cannot be sourced from other, for say, plant foods, and therefore play a very huge role in nutritional security and improvement. In addition to that, the population of the whole world, indeed the continent and the regions, is growing. And the lifestyles are changing due to urbanization, due to better incomes, disposable incomes, and lifestyles are changing, and people want to eat better foods, and often these are animal sourced foods, and therefore animals play a very critical role in sustaining these demands. So just to contribute to James's narration about AU-IBA and the importance of animals on the continent. And of course, if you look at fisheries.
Go ahead. Yes.
If you look at fisheries, Africa has access to huge resources, water bodies, where fisheries and also can play a very big role. Another rich source of proteins for our human growing populations. Okay, over to you, Philip.
Thank you. Sorry, thank you very much, Henry. I also see Dr. Annie has a hand up. Please, Dr. Annie.
Yes, thank you very much. I think Dr. Henry has said exactly what I wanted to say, but to be a bit more specific, it is projected that the global population and the demand for animal and animal resources is going to increase 8 times by the year 2030. So I think it is true what Professor says, is need to stop doing business as usual. Thank you.
Thank you very much.
Just Philip, to add and to come to the specific, just give figures and update all of the attendees. This is Dr. Busini.
Yes, Dr. Busini.
Yes, currently it is estimated that the animal resource sector contribute between 30 to 50% of the agricultural GDP. 50% mostly in the Saharan countries, but let's say ASAL, the arid and semi-arid areas. That's what just I want to add to complete the figure.
Okay, thank you very much, Dr. Hiva Bosini, for your contribution. From what Professor Bacha has really presented to us is the importance of why we needed to have this conversation in the first place. And from the figures you've given, livestock is really a big resource for this continent, and that's why we need to have this conversation. I will move to the next question, and this next question, I will direct it to Dr. Hiva Bosini. Dr. please tell us a little bit about the key strategies and frameworks that the AU-IBA has developed over time to support animal resources in Africa.
Thank you very much, and good morning to all the attendees. As mentioned by Professor James Wabasha, AU-IBA as the coordinating body in charge of animal resource development, has developed a key strategies together with other AU institutions in charge of also animal resources and fisheries. I will just emphasize on the prominent one. The first one is the Pastoralist Framework, because in Africa I mentioned about the ASAL area, the arid and semi-arid area, and today, on even for the projection now, even for the next coming 50 years, 70% of our animal resource production will still rely on pastoralism. This trend is not going to change right now. And the second one is the livestock development strategy, which was from 2015 to 35, to coordinate and harmonize and drive the member state on animal resource development in the continent. The animal health strategy derived from the livestock development strategy. It is a framework for delivering a sustainable animal health system in Africa that meets the World Organization for Animal Health, OIE, and other relevant global standard. There is also the animal welfare strategy. Africa was really lagging behind the other region or the other continent. And AU-IBA with partners has spearheaded the development of the animal welfare strategy to coordinate all the animal welfare practices for responsible and sustainable development of animal resources in the continent. Together with the Africa CDC, AU-IBA also has developed the Antimicrobial Resistance Framework that now all these strategies have been endorsed by the head of summit of the African Union Commission to be implemented by all the member states and the regional economic communities. One of another important strategy is the Pan-African PPR control and eradication strategies. As you are all aware, after the eradication of the reindeer pest, the next targeted disease to be eradicated worldwide, and especially in Africa, is the PPR. Another important one is the African swine fever control strategy. Because today, half of the meat consumed in the world are from the pig industry. These are the key strategies that were developed by AU-IBA, and now in the pipeline, we have this year, we are embarked on the development of One Health strategy, the Rabies control strategy, as well as the food safety strategy. Let me stop from there.
Thank you very much, Dr. Bossini, for that contribution. But if I may jump in before I ask the other panelists if they have any contribution to add on what you've already mentioned, my question would be, when it comes to development of strategies and these frameworks, most African countries have been accused of having very nice strategies and frameworks, but when it comes to implementation, that is where the problem begins. There is no will to implement the same. So we have very nice strategies gathering dust on the shelf, but on the ground, people are suffering and the solutions are already out there. So what is AU-IBA doing to ensure that even as they come, you guys come up with these strategies, they are implemented by member states in the continent?
You are very right, because someone said that the problem in Africa is not lack of strategies. We do have a good strategy, but one thing is to have a strategy, another one is its effective implementation. That's why since the last decade, all the strategy developed by AU-IBA and his sister institution under AUC, since this last decade, we make sure that the strategy is translated also to action plan. And we will also make sure that this strategy is submitted to what's called the Specialized Technical Committee of African Union Commission, which comprise the minister in charge of environment, water, fisheries, agriculture, and animal resources, so that all the member states are aware on this, will adhere and adopt this strategy. And the next step is the strategy will be, an action plan will be endorsed by the head of summit, the head of state summit of AUC. And from there, it's becoming now mandatory for all the member states to really implement the strategy and the proposed action plan. But one key thing is the mobilization of resources. And what AUIBA is currently doing is also, in addition to the adoption of, by the endorsement of the strategy and action plan by all the member states, advocating for member states to allocate national budget to implement the proposed strategy and the action plan. Because most of the time, the member states are relying on projects and programs, and so therefore on donor funding, which is not sustainable. So for effective implementation in sustainable manner, it's AUIBA advocates to member states to allocate national budget for the implementation of the different proposed strategies.
Thank you very much, Dr. Hiva Bossini. I don't know whether the other panelists have anything to add to what Dr. Bossini has said before we move on to the next question.
Yes, Philip. John here.
Yes, Jonathan, please.
So thank you very much, and thank you, Dr. Bossini, for elaborating on the strategies and the resource mobilization effort of the AUIBA and the African Union. And another area that we look at in terms of actual implementation relates to the fact that within the animal resources space, there are several partners that are intervening, and usually you find that some of the activities are duplicated, and that so what AUIBA has also been doing is having a collaborative work programming with other international organizations intervening within the region, such that resources are equitably distributed as far as practical, to ensure that countries also benefit maximally from all the partners. So for example, you would find that AUIBA would work with the World Organization for Animal Health, pool resources together and intervene on the same subject area, for example, vaccination, but in different countries. So by so doing, we ensure that those policies and strategies are implemented within the respective countries. So the point I wanted to raise was that yes, resources are scarce and implementation can be difficult, but one approach that the African Union now uses is to have a work management arrangement with the different partners, so that we can, with the little resources, intervene in different countries and yet have amplified impact. Thank you. Over to you, moderator.
Thank you, John. Indeed, resources are scarce, and especially now with the COVID-19 pandemic, things are really tough for not just for individuals, but also for countries. And the strategies AUIBA and the African Union is putting in place will go a long way in helping this. I don't know if there's any other contribution. If we don't have...
Yes, please. Yes, please. Something very small. Yeah, I think you realize that it is very important for ownership as well. If the countries are going to really embrace the strategies and the policy frameworks, then ownership is very, very key. And what we have done as AUIBA, as we sit down and formulate these strategies and the policy frameworks, we make sure we sit together with all the key stakeholders. we have the regional economic communities, we have the responsible ministers from the member states, and we have our donors or development partners. So we always make sure that they have owned the process from day one of the formulation of the strategy to implementation. And this helps us know who should do what. And it helps us not get them by surprise. So I think a lot of things are in the archives, not only strategies, but even technologies in Africa, because there was no ownership. And maybe what you formulated or what you proposed and sold to the member states, they did not need it. They wanted it done differently. So what AUIBA has done, we've really invested in buy-in from all the stakeholders as we do all our programs, strategies, and the policies. Thank you.
Thank you, Anne. It's indeed, if you can produce something for me and I don't need it at that particular time, then be sure I will not be able to use it. And I agree that ownership is a very important aspect when it comes to implementation of these strategies. And I'm sure Dr. Bossini will agree with you on that exactly. I don't know whether we have any other contributions.
Philip, really, I wanted to take the floor, but Annie has said it all. The issue of domesticating our strategies.
Just go on.
Yes, and probably what I would want to say is that once we formulate the continental frameworks, and as we have said repeatedly, we are working very closely with the regional economic communities, and what they do then is to translate this continental framework into regional specific strategies aligned to this framework. And then from that point, then there is the country conversations, what Annie has elaborately articulated, then country engagement, the country dialogue, to have the awareness, the advocacy, and so on. So it's an important area, the area of domesticating then those regional strategies to country programs, country activities is an important area where countries, AUIBA, and regional economic communities really need to have a continuous dialogue to have those documents from the shelf to the field. Thank you. Up to you, Philip.
Dr. Abacha, you are really breaking. We can't hear you well. Thank you. We could hear you well, but it's fine. Henry?
Yeah, Philip, may I just like to make an addition that
yes,
really for the implementation of these strategies, the biggest challenge is mobilizing the resources. Previously, when the donor community landscape was better than it is now, AUIBA was able to mobilize resources to support each and every member state involved, for instance, in the Eradication program, to undertake national activities. But this has recently changed, and it's becoming more challenging to raise funds for supporting each and every member state to undertake activities within an agreed strategy. But if the resources are available, member states normally implement without major hiccups. And so, as colleagues mentioned, the challenge is to get the member states themselves to invest in these priority activities that are agreed at the national, at the continental levels. And of course, member states have different competing priorities. And therefore, it's important that the national animal resource stakeholders raise their voice to ensure that the priorities that concern them and affect them are also placed at the national table of resource sharing, so that there's commitment at the national level to implement those activities agreed. Thank you. Over to you, Philip.
Thank you very much, Dr. Henry. Maybe I can ask one more question to Dr. Bossini on the same. When it comes to these strategies and that AUIBA develops, are they tailor-made for particular regions, or it is a blanket? It's a blanket strategy that the entire continent need to adopt? Are they tailor-made to individual regions or individual countries, or it is a blank, most of them are blanket strategies? Your mic is off, Dr. Bossini, your mic is off.
Sorry, I think Prof. James has already addressed it. Because once the continental strategy is developed and adopted at continental level, now the next step is the domestication. The domestication by each region and member state. This is now to cascade it to regional level and national level. Like now, if I may take the specific case of animal welfare strategy for Africa or animal health strategy for Africa, so after the adoption, the endorsement of the strategy at continental level, now AU-IBA has mobilized resources to support REX and member states to develop the regional animal health or welfare strategy, taking into account the regional specificity, because there are different specificities between the different regions, and then also cascade it at national level. But all these regional and national strategies have to be aligned with the continental one. And if there is any global strategy like for the PPR eradication at global level, it has also to be aligned with the global strategy. Thank you.
Okay, thank you very much, Dr. Bossini. I think we need to move to the next question. I'm seeing, otherwise time will not be on our side. I'll move, my next question, I will direct it to Dr. Annie Lewa. And my question to you would be, what do livestock development, animal health, and animal welfare strategies for Africa aim to achieve? Dr. Lewa.
Okay, thank you very much. And thank you, Yves, for outlining the strategies that we've already developed together with our partners and the stakeholders. If I was in high school and I was in a debate club, I would say that we've convinced the floor that there is need to transform the sector. So let me go back and say that AU-IBA has been there for the last 70 years. We've developed a lot of strategies over the years, and I'm just going to highlight a few that we've mentioned and say what they are going to achieve. One, the livestock development strategy for Africa that was developed in 2014, together with the stakeholders, aims to transform or to enhance the livestock sector to contribute more to the social economy of the African countries and the equitable growth. So that's what is going to achieve the livestock development strategy. Because we have no time, I don't think I have to go to the details, but basically what the strategy aims to do is to attract public and the private sector investments. So we are supporting the countries to do that. We are supporting the countries to enhance animal health and increase production and productivity. We are helping the countries to enhance innovation generation and the utilization of technologies. I think I'd already said that we have a lot of technologies in the archives, and we've done an audit to find out all the technologies that are available before we even enhance or promote innovation of new technologies. The livestock development strategy also tries to support countries to access markets. So those are the key objectives. And actually talk more about the livestock development strategy, it aims at promoting priority livestock value chains in the regions. And these priority livestock value chains have been identified by the regions and the member states themselves. So IBA did not tell a region, this is what we are going to support you to promote. No, we told the regions, sit down and agree amongst yourselves the livestock value chain that you want us to promote. Basically, if I'm not taking too much time, I must point out that for North Africa, we are supporting the dairy value chain. For Southern Africa, we are supporting the meat and the live animals. For Central Africa, we are supporting the poultry value chain. Western Africa, again, the poultry value chain. And then for Eastern Africa, we are supporting the dairy. And for IGAD, we are supporting meat and the live animals. And I must say that the LINDESA, the livestock development strategy, just like another strategy, is being implemented through projects. So at the moment, we are implementing LINDESA to achieve these promotions of the dairy value chains through a project we are calling the Live2 project. So I think that's what the LINDESA, or the livestock development strategy, is aims to achieve. Then my colleagues have also talked about the animal welfare, animal health strategy for Africa. This, we have realized that the African livestock resources have not been exploited. One of the key challenges is because we have issues with animal diseases. So the animal health strategy for Africa aims at bringing people together to address specific challenges that are posed to the livestock sector by maybe lack of proper disease control. So what we are going to do with the strategy is that we are going to bring people together, regions, member states, to coordinate disease control and prevention. And I think I don't need to talk so much about that framework, but the animal health strategy basically is going to strengthen animal health policies and institutional frameworks. It is going to reduce these risks and the impacts on animals and humans. The strategy is going to improve capacities. And then it's going to improve capacities to access to inputs and the markets and the trade. It's going to promote research and the knowledge. And the animal health strategy also is going to enhance partnerships in investments. If briefly, you can allow me to go through the animal welfare strategy again. And as I said, this animal welfare strategy was also developed with the coordination from AU-IBA, but with the involvement of stakeholders. Among them, the OIE, we have the animal welfare strategy for Africa also being supported by the AVO. They were part of the people that supported us to implement it, regional economic communities, and the member states. And this is going to support training, education, and awareness on animal welfare. The strategy is also going to improve communication and advocacy for animal welfare. It's going to support policy and the legislation, and it's going to support research, resource mobilization, and the monitoring and evaluation. So you may ask, why the animal welfare? We say that animal welfare translates to human welfare. So it is going to be very important to promote these three strategies in Africa. And I think now it is already clear what each strategy is going to bring in to the sector. Thank you.
Thank you very much, Dr. Anilewa. Any contributions from the other panelists on what Dr. Ria has just elaborated?
If you allow me, Philip.
Please, Professor.
I hope I will not break this time. Just to add on to what Annie has said, and I think it's important because we have this interesting dialogue with our participants to realize, and I would want to talk about the animal health strategy for Africa. This particular strategy is telling us as a continental body, as regional economic communities, as member states, to do business unusual. It's business unusual because with the time we have realized that to address an animal health issue goes beyond the usual traditional animal health approach in the sense we really need to look at human, socioeconomic factors, and environmental factors in order to address animal health issues comprehensively. And this particular strategy attempts to take that direction towards a very holistic approach to animal health through the specific objectives Anne has clearly and well articulated. So in implementing this strategy, we want to avoid the losses that the sector is incurring from animal diseases. It's huge in the continent. About $4 billion are lost every year. It's like we are losing a quarter of what we produce in the animal resources sector. And therefore, we need such a holistic approach in order to be able to address the issues of animal health from a very broad perspective. So I would encourage colleagues and member states and regional economic communities, as we try to domesticate this particular strategy, to really take that approach in line with the current thinking that we cannot address animal health from a narrow perspective. Up to you, Philip.
Thank you very much, Professor Bacha.
Can I
Go ahead,
add,
please, Dr. Bosin.
Thank you. Prof has already elaborated on the animal health strategy for Africa. I would like just to add something for the animal welfare strategy for Africa, because when you talk about animal welfare in Africa, it is seen like a foreign concept. And for a long time, the welfare of animals is not seen as inextricably linked to the welfare of human. The human well-being and animal welfare are going together. That's why today we are talking about one welfare and one health and one welfare. And this area was left blank in Africa. Only NGOs intervening in this area. So it was critical for AU-IBA as the continental body in charge of animal resource development to come out with a comprehensive framework to coordinate all animal welfare activities across the continent. Therefore, the adoption and the launch of the Africa Platform for Animal Welfare show that the devotion of the African Union Commission for responsible development of animal resources. Today, this the strategy and the action plan really will be lifted and brought ahead to the next stage in the journey toward Africa, an Africa where animal welfare in animal resource industry is one of the foundation stone for animal resource development and sustainable environment in the continent. Over to you, Philip.
Thank you very much, Dr. Bosini. I see Dr. Annie's hand is up. Dr. Annie, before I ask your question that just come to my mind.
Mm-hmm. Oh, also I can talk before you ask?
I can ask, maybe then you answer both of them.
Oh, fine.
Now that we are talking about animal welfare, let me give an example of one that, and maybe you will tell us what AU-IBA is doing to address this problem. There's been this issue of sprouting slaughterhouses for donkeys, and we hear that if we are not careful, the donkey will be extinct by the year 2030, if I'm not wrong. What is AU-IBA doing as one of your examples when it comes to animal welfare
what is AU-IBA doing to protect also this particular animal? It's a very important animal, especially in Africa. As you add to what you are to say, your contribution that you meant to add.
Yeah, maybe
Please go ahead.
I start with your question. Then I can add what I wanted to add, what Dr. Hive had said. One, issue of extinction is not an animal welfare issue. The animal welfare issue is how are you slaughtering that donkey or that cow or that chicken? Are you doing it in a humane manner? And the animal welfare doesn't just come to the slaughter, even to the management. How are you housing that animal? How do you feed that animal? And for the working donkeys, like working animals like the donkey, how do you work that animal? How do you load it? How do you feed it even after working? Back to the issue of the donkeys being extinct, I was just telling a colleague this morning actually that the donkey in Kenya has been passed as a meat animal. So it is actually a meat animal. It's only that we treat it with a lot of prejudice. So like we protect all other meat animals, then we are going to protect the donkey to make sure, of course, we look at the genetics. We can even do air in the donkeys to make sure we have enough to eat and work for us. But we should be very humane the way we treat that animal. So the issue of slaughterhouses are okay, but is that slaughterhouse allowing humane slaughter of that donkey? But the issue of whether it is going to become extinct or not, then I think another department handles that to make sure, like we do air in animals, to make sure we still have a good quality meat and the work donkeys in the future. The ministry should look at that. But my emphasis is to make sure that donkey is kept well, fed well, slaughtered humanely for meat animals. So it is a meat animal. So having said that, I just wanted to add something small to what Dr. Eve and Professor Wambasha have said about embracing animal welfare in Africa. Indeed, we were doing a project as AU-IBA to review and amend livestock legislations in Africa. And I was privileged last year to visit countries and see what they had included, what they had recommended for review and amendment. But I was a bit disappointed that very few countries had included inclusion of animal welfare into their policies and legislation. So this strategy is going to take us very far in embracing that concept of animal welfare so that we come up with proper policies and the legislation that promote animal welfare in Africa. So what Yves says is very true. For a long time, we have not embraced the concept of animal welfare. The NGOs did it, but they were mainly on the working animal and the pets. It was not very integrated. So the strategy is going to allow us to integrate and treat animal welfare in totality. Thank you very much.
Thank you very much, Dr. Hiv. Go ahead, Dr. Bosini.
Yes, just to add on what on the specification on donkeys. That donkeys are imported in Africa, mostly in most of the African countries. Donkeys, especially where I'm coming from, Sahelian countries. Donkeys are considered as the first son of the poor. And as we are working closely with key partners on these donkey issues, and especially what you mentioned about the slaughtering house, the abattoir, the donkey skin trade. We have conducted a study across the country that will now, we have done the analysis, and soon the report will be out. What we are doing also this specific issue, on this specific issue of donkeys, so in close partnership with the Brook Hospital for animals. Thanks also, let me take this opportunity to thank them because they have been our key partners in promoting animal welfare agenda in the continent. There will be a regional meeting in West Africa on donkey species exploitation. That the national government will come together and then discuss how we protect, come with a common voice, a common position on the protection of this very important species in Africa. The key activity that AU-IBA will really conduct is to call for a Pan-African conference on donkeys. Under the theme is that following the over-exploitation of the donkeys across the continent, to come out with a common understanding and a common framework on this species exploitation and protection on the continent. Thank you.
Thank you very much, Dr. Bossini. I see Dr. Annie's hand is still up. I don't know whether you still want to contribute or it's an old hand.
No, the hand just refused to go down because of technology. Sorry about that, Philip.
No problem. Let's move on to the other part of this conversation. Let's look at the intervention now being put in place or being rolled out. Let me frame that question again. Let's just now look at the interventions put in place to roll out the animal welfare strategy. And my first question will go to will go back to Dr. Hiva Bossini. When it comes to rolling out these strategies, communication is very important. So when it comes to communication of these strategies to stakeholders and partnership, maybe you can tell us a little bit of how AU-IBA is doing this kind of communication to ensure that the information is received as it's supposed to be.
Thank you, Philip. The strategy was developed and endorsed together with the establishment of Africa Platform for Animal Welfare, which comprise the key actors intervening in the area of animal welfare, mostly all the member states, the African member states, all the regional economic communities, all the international organization, research, veterinary school, civil societies, and the key animal welfare organization present in the continent as well as the national association. And all, they are all, this strategy is not only for AU-IBA, it's for member states and all the organizations which embrace the animal, which embrace animal welfare activities. I said during my previous intervention that the strategy was really meant to coordinate all animal welfare efforts across the continent, to guide all the partners, member states, on the priority activities on animal welfare. I only mentioned that because it was a new concept, it was not part of the national veterinary legislation. And today, now since the last 3 years, AU-IBA is supporting all the member states to mainstream, advocating also to mainstream animal welfare issues in the national veterinary legislation, Animal Health and Production Act at national and regional level. The second thing is now mobilize resources to assist member states and RECs to develop the regional and national animal welfare strategy in line with the continental framework. So the good example is now that the East African, all the member states of East Africa have now developed and adopt their national animal welfare strategies as in line with the East African, the regional animal welfare strategy for East Africa, which was also developed in line with the continental framework. Other REC are now also on board. The ECOWAS region, West Africa, has already developed and validated its regional animal welfare strategy in line with the continental framework. And currently, we are supporting Central Africa, Northern Africa, and discussion is going on with our partners to support the South African region to develop the regional animal welfare strategy. Thank you.
Thank you very much, Dr. Bosini. Any other, Dr. Annie, your hand is up?
Yes, now it is intentionally up. Back to the question of communication. Okay. Yes, I think Eve has said it all, but I just want to emphasize on the fact that AU IBA has a strong communication department. We have a communication officer who also translates these strategies. You know, the strategies are very technical. The regional economic communities will understand, the member states will, but what we call in Kenya, Wanjiko, the end user, you know, that farmer, may not understand. So what the communication officer does with all the strategies and the frameworks is that she translates them into a language that anybody who is not a veterinary doctor may understand. So to make sure all the strategies, not only the animal welfare strategy, all the other strategies, to make sure they are palatable by the end user. We also make sure we have pliers and the other, we process them to a language that anyone can understand, and then we distribute them. So it is possible that communication can be an issue, but we make sure we are only not communicating to the technical only. We also communicating to what we call in Kenya Wanjiko, the end user who may not understand the technical terms. Thank you.
Thank you very much, Dr. Lewa. Any other contribution from the panelists? If there's none, I will move to the next.
Philip, you're muted. You're muted, Philip.
Thank you for that. Okay. You want to say something?
No, it's fine.
Okay, thank you very much. I was saying now, if there are no more contributions from the panelists, even me, I don't have a question. I think we've that part was really covered well. Let's move to the other question on antimicrobial resistance. And this time, my question is going to John Opong. John has been quiet for a while. Maybe this is what he was waiting for. Maybe, John, you can tell us what the African Union or AU-IBA has been working on when it comes to antimicrobial resistance and antimicrobial use. Please go ahead.
Thank you very much, Philip. So the question of antimicrobial resistance is an interesting one, and I suspect that all the participants and panelists gathered here today may have at a point in time interacted with an antibiotic or an antimicrobial. These are very important tools that are used to fight various infections, as all of you may know, and have really changed the scene when it comes to public health and animal health. The concept of antimicrobial, just a little background, naturally you would expect these microorganisms over time to change, adapt. They call it mutation. So it's a natural phenomenon, but we notice that human activities have accelerated this phenomenon. And so we are seeing situations where drugs that initially could be used to cure various treatments are no longer effective against the same. So that is the principle. That is the antimicrobial resistance. The world has noticed that this is no longer just a public health issue, but also a development issue. Available estimates seem to indicate that annually we lose almost 750,000 people due to antimicrobial resistance microorganisms. So it's a huge problem for the whole world. And because of this, there has been global commitment at the UN level of the need to mitigate and contain the harmful effect of antimicrobial resistance. And this has trickled down to the various agencies and institutions in terms of the approach that we use to support member states in dealing or addressing the harmful effect of antimicrobial resistance. So for example, at the global level, we have what we call the tripartite, the FAO, the OIE, as well as the World Health Organization, which are organizations that most of the African Union member states also are members. So there is a global action plan. Now, the African Union has tailored this global action plan into what we refer to as the AU-AMR framework, and that is our working document for delivering interventions to various member states. But the question of AU's intervention, it goes beyond AU because AMR is a multifaceted concept and requires different actors and players. So what the African Union has done is to partner with the other UN agencies, the FAO, the WHO, the OIE, the UNEP, because there are the agric component, the medical component, the environmental component, the animal production component of it, the so-called concept of One Health, working together to achieve one common aim. Specifically with regards to the AMR framework, what we are currently doing is that we've noticed that most of the countries do not have surveillance systems in place. And surveillance enables you to determine trends where we are likely, which value chains we are likely to have more resistance in the future. So you are able to predict, if you like. Most of the countries are now in the process of building labs and capacities to detect. And so AU, together with the UN agencies, are delivering various capacity by way of lab training, building quality assurance so that credible results are churned out for decision making. The other area which we have noticed deficiency and are working on relates to awareness and knowledge. You would notice, and I guess most of us here on the platform might be corporate, that if you notice you are sick, you just go to the drugstore, the chemist, and you lodge your complaint, and chances are that even without clinical diagnosis, you would be given some antibiotic to take. You are contributing to antimicrobial resistance. Okay, so what we need to raise the awareness of everyone, be it professionals, be it the producers, the farmers who use the antibiotics or antimicrobials. So we engage a lot in awareness creation activities, but we don't do it directly. We work with the member states, depending on their advocacy schedules, bring stakeholders together and create that awareness in terms of bringing knowledge, what they should be aware of, the things that they should be doing to avoid or limit antimicrobial resistance. But with regards to animal production sector, specifically our interventions are focused on creating awareness and knowledge, building capacity, especially on good husbandry practices and good hygienic practices, because we know that if we can implement good husbandry and hygienic practices, you limit the ability for microorganisms even to be in the environment and so they would not infect the animals in the first place for you to use antimicrobial. So this is a preventive measure, and we encourage farmers to do that. The other area that we are intervening on together with the tripartite, the FAO, OIE, and the WHO, relates to the area of regulation. Regulation in terms of market authorization. Several porous borders and sometimes the antimicrobials that come into the countries do not go through the right approvals to determine their efficacy. So some are falsified, some are substandard. One of the activities that we are supporting countries to do is to build strong regulatory systems so that member states would be able to enforce regulations in terms of having quality drugs that are potent enough and can address treatment issues. So these are some of the interventions that the African Union, together with the other partners, the tripartite, have been working on in the space of antimicrobial resistance. Over to you, moderator.
Thank you very much, John, for that contribution on antimicrobial resistance and what AU-IBA is doing to have this conversation with member states to ensure that we are able to deal with this problem. I don't know if there's any contribution from the floor. I see Anne's hand is still up. I don't know whether it's the old hand or it's a new one. Anne, please.
I have not developed a new hand. It is the old one. Sorry, Philip. Let me lower it.
Okay. Anyone else who wants to contribute to what John Opong has presented to us? If there is none, we will move on to the next question. And this question will be directed to Dr. Henry Wamai. When it comes to interventions put in place by AU and AU-IBA, when it comes to control and eradication of sheep and goat plague, that is PPR. I understand even Kenya had their own strategy on how to eradicate it. They even had an earlier date than the set date of eradication for the region. Maybe you can tell us a little bit about what AU and AU-IBA is doing to ensure we eradicate PPR.
Okay, thank you, Philip. As mentioned earlier by my colleague, Hiver, peste petit ruminants, or PPR, is first of all a viral disease. It's caused by a virus that belongs to the same genus, if you like, or the same group as the viruses that cause measles in human beings. There's a virus that causes a disease called canine distemper in dogs, and a virus that causes a disease in marine mammals. And these are all related. Generally, these are viruses that affect large populations of animals, and they have devastating effects. It also, is related to the rinderpest virus that was eradicated a few years back. Viruses that cause devastation and therefore draw attention and concern of farmers and other stakeholders. Now, after the eradication of rinderpest in 2011, the global community, led by FAO and OIE, determined that PPR should be the next animal disease to be eradicated. Now, rinderpest was the first animal disease to be eradicated globally, and it was the second infectious disease after smallpox to be eradicated. So far, only two diseases have been eradicated globally: smallpox and rinderpest. Smallpox of humans, rinderpest of animals. And so the veterinary community decided that PPR should be the next disease after rinderpest to be eradicated for good reason. One, that there is a good tool for controlling the disease, a good vaccine, which requires only one shot and it protects the animal for at least 3 years. And 3 years in many production systems is the lifetime of a sheep or goat. And so we could say that the vaccine protects sheep and goats, offers lifelong protection with one shot. Secondly, there were good tools for the identification of this disease, good diagnostic tests that accurately identify the disease. And thirdly, that the disease is transmitted by direct contact. So if you cut off direct contact, in other words, if you limit movements, as we're being told for COVID-19, then the opportunity for spread is limited. There is no carrier state. In other words, if an animal recovers from the disease, it is not likely to one day reactivate the disease and transmit to other animals. Okay. So these are good features that lend the disease to eradication. Now, in Africa, AU-IBA led efforts to bring to the attention of our ministers initially the need to eradicate PPR. And in 2010, when we were sure that rinderpest was eradicated from the continent, we raised this at a ministerial meeting that we convened in Kampala, Uganda. And the ministers mandated AU-IBA and the regional economic communities to proceed to develop strategies for the eradication of PPR and mobilize the necessary resources. Now, the global community caught up in 2015 through the development of a global control and eradication strategy for PPR. And because it's a transboundary disease that requires a concerted efforts of all actors and all regions of the world to achieve eradication, AU-IBA revised the Pan-African strategy to align with the global strategy in 2015. And since then, we have provided support to the member states of the African Union to develop national strategies. And to date, together with our partners, the Food and Agriculture Organization of the United Nations, or FAO, and the World Organization for Animal Health, or OIE in brief, in total, we have provided support to 49 out of the 55 member states of the African Union to develop national strategies with some action plans for the eradication of PPR by 2030. As you rightly said, Kenya's target is to eradicate by 2027, and they launched their strategy in 2018 officially, through a public pronouncement by the minister. Now, in addition to that, we have also supported some member states to implement aspects of their strategies. We have supported some member states and continue to do so to undertake surveillance activities. And these are member states that we think have a high likelihood of declaring freedom soon, maybe sooner than 2025. Supported them to undertake surveillance, to provide the evidence needed to have them recognized as free from the disease. And having said that, so far, 6 member states on the African continent, that's Botswana, Eswatini, Madagascar, Mauritius, South Africa, and Lesotho, are recognized as free from the disease historically. They have never had the disease, and they presented the evidence of the absence of disease in their countries, and this was accepted by the OIE and officially endorsed. So they're recognized as free from the disease. One member state, Namibia, has a PPR-free zone. Most of the country is free. In fact, perhaps the whole country is free, but one zone is maintained as a surveillance zone because of its proximity to other neighboring countries where the disease is present or may be present. And so they are cautious not to declare the whole country free, but to maintain that zone. But that is the situation. The other member states on the African continent do not have an officially recognized status for PPR and are considered infected. But as I said, the disease is present in 36 out of 55 member states. In other words, 2/3 of the continent have reported the disease. And the disease has caused tremendous losses over the years, affecting mainly the livelihoods of pastoral communities, affecting employment opportunities in those communities, and affecting the nutrition of households, particularly the women and children who are largely responsible for looking after sheep and goats. In addition to these efforts, we have also participated together with the OIE in providing training to member states on how to gather evidence and prepare dossiers to verify the absence of disease towards eradication. So these are efforts we have put in place to support member states. Now, the key challenge, as I mentioned earlier, is resource mobilization. Getting the resources to ensure that all the member states can act at the same time in a coordinated manner to achieve eradication, because that would be the ideal situation in achieving eradication at the shortest possible time. But AU-IBA is making efforts to mobilize resources, although there are other competing priorities. And of course, recently, the COVID-19 pandemic has grossly interfered with these efforts. Over to you, Philip. Thanks.
Thank you very much, Dr. Omwai, for that contribution on the strategies being put in place for the eradication of PPR. I don't know whether there's any other contribution from the panelists. Well, if there is none, I will also move on to the next question, and that will be still directed to John Opong. What strategies have been put in place, especially when it comes to trade in animal products? John, please.
Thank you very much, Philip. Again, I'm aware colleagues may already be aware that the African Union has coordinated member states to now operationalize the African Continental Free Trade Area Agreement. Trading started in January, 1st of January this year. The AFCFTA brings together an African market with consumer population of almost 1.2 billion. And so it presents a huge opportunity for the whole of the continent, and especially given the important role that animal resources, animals and animal products play in the economies of African countries. We expect that trading in animals and animal products would contribute significantly in terms of trading potential. So the AFCFTA implementation would be driven by several tools, and one of them is the African Union Framework for Sanitary and Phytosanitary Measures. So the fact that countries have opened up their markets does not necessarily mean that country A can just send products to country B. They must still fulfill the requirements, the standards. So if the animal is diseased, infected, it cannot be traded. That is the concept of sanitary and phytosanitary measures. And we know that usually, even though tariffs are important when it comes to trade, by far non-tariff measures, such as the way that standards and certain protocols are implemented by way limit trade. And so one of the areas that the African Union is strongly focusing on is how we can implement standards in a way that will limit or that will facilitate trade in animals and animal product. So the first issue that AU-IBA has been looking at relates to veterinary regulations and legislations, updating these regulations in line with international standards. We know that standards could, when not applied in the way that they should, can really obstruct trade. So this is an important component of our work. Veterinary legislation review and regulations are critical in facilitating border trade. The other issue, the other area of work that AU-IBA engages in is on capacity building with respect to quarantine and inspection officials. These are the interfaces at the border points, and they would need to inspect and approve products coming into countries based on applicable standards. And they must also use risk-based processes that are internationally accepted. So you notice that in some countries, this knowledge and skill may be lacking, and that can influence how products are admitted into countries. So AU-IBA focuses on trainings, building the capacities of inspection officials as well as quarantine officials to equip them to apply the standards as they should in a manner that would not obstruct trade. Another area that we are currently looking at also relates to supporting member states to develop standards. AU-IBA is not a standard-setting organization, but because we intervene on animal product issues, we support member states to participate in international standard-setting activities, such as the OIE and the Codex Alimentarius Commission, which develops standards on food safety. This is a very important activity for us because, as you know, international trade is governed by standards. Standards are the currency for trade. The more African countries participate in international standard setting, the better our interest would be incorporated into these international standards, and so our trade interest will be protected. So AU-IBA supports member states through reviewing various draft standards and proposing standards that do not exist and we feel, if developed, would facilitate trade within the region. So that is another area that AU-IBA intervenes when it comes to trade and standards. The other area relates to capacity building, which is mostly related to building the competitive, the productive capacity of producers. You know, having standards is one, but building the productive capacity for member states to produce in the volumes that are required to support the consumption patterns is also very important. Building capacities of member states to produce value-added product are also very critical. The point I'm making is that we intervene on animal production issues, which directly promote trade. In terms of technology, we support member states to implement technologies that add value to their productions. The last area that I would want to talk about relates more to policy aspects of trade. As a political institution, as well as a technical institution, AU-IBA also convenes various policy groups to dialogue on different trade issues that need harmonization in order for trade to be facilitated in the area of the animal resources sector. So regulatory forums are important avenues that we deliver this particular activity, bringing chief veterinary officers together, bringing animal production officers together to discuss common trade issues that affect intra-African trade. Is one way of promoting confidence and trade amongst African trading partners, and thereby facilitating trade in animals and animal products. So these are some of the trade and standard related areas that we intervene on. And I am sure my colleagues would want to add on to that.
Thank you very much, John. Any contribution from the colleagues?
I think
maybe I can, if you allow me, Philip, I can interject.
Please, Professor, just proceed.
I just add on to what John has articulated, and this will be in regard to also what Henry talked about, that for us as a continent to trade among ourselves and with other regions, we really need to capacitate our veterinary delivery systems, which have been found to be weak when evaluated using the OIE standards. So because for us to be able to trade, just like John has said, we really need to detect diseases immediately they occur so that we localize the diseases and allow other areas that are not infected to continue trading. So the area of capacity development in terms of veterinary services delivery is a key area to enhance capacities for surveillance, for diagnosis, and also to be able to prepare and respond when these diseases occur. Because when you have outbreaks of diseases like Rift Valley fever, out of fear, you get to have even all local markets closed. So we need to detect it early, we need to localize it and contain it within the area of outbreak so that we are able to trade as a region. You recall during the previous outbreaks affecting even one country, this had an impact on all the other countries in the region, in the Horn of Africa. So that capacity to demonstrate that we are able to detect diseases and demonstrate this to our trading partners is very critical in order to create confidence as far as trade in animals and animal products is concerned. So another area we are also working on to promote trade is engaging our trading partners. Because trade is about trust, and they need to know what you are doing and engage them so that also together you can discuss and agree on what other measures you need to put in place. And AUIBA has been facilitating dialogue with the countries in the Middle East, including Egypt, to try and promote trade between the Horn and that particular important market for animals coming from the Horn of Africa. So engaging them is also important, and we do support trade missions, even to for example, the Dubai Food Fair. So in order to enhance this kind of interaction, benchmarking, and also to talk to the veterinary authorities in the Gulf. So up to you, Philip.
Philip, allow me to say to add something also on what my colleague said, John and Professor James Bacha, to emphasize that transparency and accountability are critical for safe trade when it's come to intra-Africa and inter-regional trade of live animals and animal products, and also worldwide. They have already talked about building capacity of member states and in participating in the setting of animal health standard. But one thing I also want to emphasize on is that AUIBA also for this to promote safe trade among member states and trading partners outside country, the continent, is to build capacity of the different member states on the quarantine procedure and practices using the OIE guideline when it's come to trade of live animals and also the animal product. One other thing, teaching, it has been piloted in Eastern Africa, and then now it will be extended to the other country, the other region. Is the SMPAH approach. It is standard method and procedure in animal health, where to harmonize the intervention measure when it's come to animal disease control, surveillance, containment, and containment. James has mentioned it. These SMPs have been developed for and implemented in Eastern Africa, but soon it will also be extended to other countries. All this is to really promote a safe trade and improve the access, the access to regional and international market to African animal product and live animal and animal product. In one word, it is about to put Africa in the world animal resource economy. Over to you.
Thank you very much, Dr. Bosini. Any other contribution? If we don't have any other contribution, I also see we have a lot of questions that are coming from some of the people that have also logged into this webinar. And I realize our panelists have been answering some of those questions because we may not have time at the end to answer all of them. Just send your questions on our chat side, and then our panelists will be able to answer some of them. Now let's proceed to the other question of the day. And this one I'll be directed to Professor James Bacha. What interventions have been put, especially when it comes to One Health approach in management of animal diseases of public health importance? Please, Prof.
Thank you, Philip, once again. John has introduced this important area of One Health approach when it comes to addressing issues, matters to do with antimicrobial resistance. He has ably indicated how the human health, animal health, the environmental health, including plant health, are all interconnected. And so I will really not delve into a lot of details with this, but basically is to just share with colleagues as we engage one another that in a few words, when you are talking about One Health, you are talking about a holistic approach to management of health. That's basically what it is. You want to deliver as one because you are addressing common issues. And if you do not address those issues as one, then you are likely not to succeed much. So, and I'll take an example I like taking, the example of rabies, which is a public health issue. Rabies, as we all know, is a disease of dogs, so mainly, that's where it comes from. And of course, once in a while, unfortunately, for our rural communities, they get bites from rabid dogs, and they end up coming down with this very, very, very terrible disease. And if you look at rabies, therefore, as a disease basically of dogs, and then with an impact on public health, the best way to approach this issue is to have the agriculture sector and the public health sector to work together, because if you have to invest towards control efforts for this disease, you need to pool resources. Because as I say, if you look at rabies, the agriculture sector may not invest. It's not a priority because there are competing issues, and may not invest much to manage the issue. But again, it's a serious public health issue. And therefore, there would be need for the two to pool ideas in terms of awareness, in terms of how you respond in order to manage this common issue. So basically, by using that example, then you can really understand where we are coming from when you are talking about One Health, which also involves other, apart from the usual endemic diseases in the continent, there are also new diseases coming up, the Ebolas, the severe acute respiratory syndrome, and all of that. There are new diseases that are coming up, and also they are coming from animals. We call them zoonotic because their origin is animals, and therefore they will need the two sectors to work together in order to manage the diseases. Having said that, then, as AUIBA, what are we doing in order to bring this particular approach into practice? It has been a discussion for quite some time, but we have not received a lot of traction on the ground when it comes to the practice of what we know should be a good approach in order to manage these issues that cross border. And as AUIBA, and as it is very well articulated in the animal health strategy, that is our first attempt in order to work with regional economic communities, our global partners, and our member states to stimulate interest and to stimulate practice of One Health in management of these common issues. So the animal health strategy is very, very clear on this, and it has very clear objectives with the associated strategies that, if addressed, or rather if they are taken on board, then will go a long way in addressing these common challenges. And what we are doing as AUIBA, as clearly stipulated in the strategy, is to work with member states, one, to identify where are we in terms of implementing or addressing these common challenges using the One Health approach. And we have held a continental consultative meeting with member states to really understand, and with regional economic communities, because that's the beginning point, to really understand where we are as far as practicing One Health is concerned. And we have identified gaps, we have identified the challenges and opportunities that exist. And some of the challenges we have seen include lack of coordination among the sectors, as I have briefly explained in case of rabies. We have seen, as was also elaborated very well some time back by Annie, that the institutional frameworks do not favor the implementation of the one or the practice of One Health approach. Also the registration, because without a registration, without a strategy, really you cannot move far, because by having a country having a strategy, a registration is really a commitment for the government to really support the management of animal health through this approach. So these are some of the gaps we have realized, and what we are doing, working as AUIBA and also with our partners, is to try and initiate some programs, some projects that really we can work with member states and also with our partners in order to stimulate interest in the practice of this important approach as far as management of common health issues are concerned. So right now, what we have a program we call RIVE2, supported by the European Union. It has a component, it's a very integrated program addressing all aspects of livestock development in the continent. And one of the components is animal health. And within the animal health component, we will be working with the member states to try and address some of the challenges they have clearly identified as the challenges affecting the practice of this very important approach in the management of health. So I think for the time being, I would want to say that much. Back to you, Philip.
Thank you very much, Professor Bacha. Any contributions from the other panelists?
Yeah, and just some small emphasis. I think Professor said it all, Philip.
Please, Annie.
Yeah, I just wanted to say that in this, what we call zoonotic diseases that are affecting both humans and the animals, actually by the time a human being dies of that disease, it has already been seen in an animal. And I'm talking about brucellosis. Brucellosis is a disease we get from cow's milk when we don't boil it properly and the animal has been sick. And for a long time, the medical doctors were not able to diagnose that disease in human beings. Unless you are lucky enough to have a vet around you and they would say probably this brucellosis, then your life would be salvaged. Rift Valley fever still kills a lot of human beings after it has already been seen in animals. And also avian influenza. So I just wanted to emphasize what Professor said, that there's need to work together with all the sectors. If we are going to salvage the health of these countries, the African countries, we need to work together. These diseases are emerging, others are re-emerging, they have been eradicated, they are coming back, and they're affecting both humans and animals. And there's really need to emphasize on one health. Thank you.
Thank you very much, Dr. Annie. Professor Bacha, I also understand when we talk, especially now we're talking about zoonotic diseases. COVID-19 is a zoonotic disease, if I'm not wrong. Is there a strategy by AU-IBA a strategy that is able to help these African countries or member states to prevent future occurrence of pandemics like the COVID-19 pandemic that was is said to be a zoonotic disease?
Thank you, Philip. Thank you for that interesting question. And COVID is a good wake-up call for all of us, really to emphasize or do much more than we have done before, because we have seen the outbreak of or emergence of this new disease is not if, it is when they will occur. So if that is the situation, then what we are doing then is to try and work with the member states. As I said, the animal health component I talked about for the Live 2, what we are doing is we have reconfigured it a bit to try and address the issues of disease preparedness plans, the contingency plans, so that countries are better prepared to address emerging issues, including antimicrobial resistance and also emerging infectious diseases, especially the diseases with origin in animals. So it will be an interesting area for us going forward, trying to build capacity for preparedness. We are doing much more, because with COVID, we looked at our activity and said, what do we need to do given the new context? Really not new, but it's a context nobody expected, that you have a pandemic bringing everybody to a standstill, creating havoc to our economies. So the issue of addressing emerging diseases at its source, even preventing them from spilling over from where they come from, the reservoirs in the environment. These are critical issues. I think going forward, we will see a lot of investments in these areas to build capacities of member states, institutions, global organizations on how to manage better these diseases before they create the havoc we have seen with COVID-19. So it's an interesting area for all of us, the continental organization, regional economic communities, our global partners. I think going forward, we really need to to focus more on this because we have seen it's devastating. We have seen with COVID, and I hope another outbreak, another pandemic will hit us when we are not very well prepared, because it happened, but without within a very short time, it was spread all over the world, because we are moving from one country to another. And this is not a period like we used to have during the flu outbreak. Here, these currently people are moving. And therefore, the question you have asked is an issue then us and others really need to put a lot of effort in this, to prepare our countries to enhance their capacities to detect these diseases and to prevent them from spilling over from animals into our domestic animals and also to our human population. Thank you.
Thank you very much, Professor Bacha. It is indeed a scary reality. I see Dr. Bosini has his hand up. Bosini, please.
Yes, thank you. Just to add on what Prof has said, and to address also your question, because COVID is a very good example on to really a good example for One Health and AUI has this outstanding experience for advocating since around 2005 for multi-sectoral, multidisciplinary approach in Mamba State. And with COVID pandemic, at national level and even at continental level, has brought together all both veterinarian and public health workers to work together, because in most of the African member states, the veterinary laboratory play key role in the diagnosis. Even now, continue also supporting the detection of COVID in member states. That just to emphasize that on that EU-IMA has really been strengthening the advocating for the multi-sectoral collaboration at national level. And I mentioned that we are on this area, specific area of One Health, just to say that AU-IBA is not working alone in this particular area. We have the Africa CDC, the Africa Center for Disease Control, working together. I mentioned in that we are working together to develop One Health strategy for Africa this year. Over to you.
Thank you very much, Dr. Bosini. I think we need to move a little bit faster. I think we have less than 10 minutes, and I'd like us to move to achievements. I know we've talked about strategies and all the things that AU-IBA has been doing in Africa when it comes to animal health. We want to see a little bit of the achievement that AU-IBA has been able to achieve in the last few decades. And maybe I'll go straight to John Abong. What are some of the achievements that we've been able to attain as a continent when it comes to common voice, especially when it's come to international and food safety standards? John.
Thank you, Philip. African Union member states, majority of them are also signatories to the WTO, World Trade Organization agreement. This agreement, which deals with trade, requires member countries to base their trading on certain international standards. On animal health, the international standards developed by the OIE, and for food safety, the international standards developed by the Codex Alimentarius Commission. Now, this is important because in cases of trade arbitration, these are the normatives that are used to judge And so it's very important within the WTO that all countries participate in the development of these international standards. Prior to AU-IBA's intervention in the area of international standard setting, we noticed that African Union member states were participating in these international fora all right, but uncoordinated in terms of preparation to scientifically respond to the standards in a way that protects our interests. Someone will say that if you are not on the table, might probably be the menu. That seemed to have been the case prior to our intervention. But through a series of projects, for example, the Pan-SPOSO project, which sought to enhance Africa's participation in these standard setting bodies, Africa now has a coordinated voice. And indeed, this African voice issue is fronted at the very highest level by our heads of state, who have directed us that for all international fora, African Union member states should speak with one voice. So when it comes to developing OIE standards, African Union AU-IBA commissions a group of experts who meet and review these standards. After this, we have a whole continental meeting of chief veterinary officers who now intervene and make sure that the common voice serves the interest of Africa. The same also applies to food safety. What has been the achievement? Africa is now seen as a stronger voice when it comes to international negotiation on animal health in the OIE. You now have a situation where more trading partners are willing to reach out to Africa as a bloc in terms of even soliciting our support and also getting an understanding of whether certain standards would favor the African continent or not. So that is what our activity has brought to bear. The fact that Africa can now speak with one voice and strong voice for that matter, and making sure that our animals and animal products do not suffer from international standards. And these may come in the form of regulation, institutional. Sometimes the standards that are established may not favor you in terms of the regulatory and institutional setting that you have. So these are some of the areas that we have been intervening on, making sure that whether it is on regulation, whether it is institutional, whether it is on capacity, Africa is duly taken on board in these international negotiations. That has really helped to promote African products on the international scene. Thank you, Philip. Over to you.
Thank you very much, John. I don't know if anyone from the panel has anything to add. I still see Dr. Bosini's hand is up. I don't know whether he has something to say.
No, on this particular one, and I think it is straightforward question of the common position, bringing African together to as one to address any concern of interest in Africa. John has comprehensively responded. I don't have anything to add again. Thank you.
Thank you very much, Dr. Bosini. As we wind up, I have one question that maybe I'll ask. I don't know who will answer it for me, but with all this conversation we've had, I've not had, I know we live in the technology age, I've not had which part technology plays, especially at AU and AU-IBA, when it comes to animal health. What technologies are you using out there, especially when it comes to surveillance of some of these diseases, especially the ones we've talked about of zoonotic diseases like COVID-19?
Maybe, Philip, if you allow me,
please go ahead, Prof.
As AU-IBA, and I think this is very important for us as we engage our participants, I will request Hiba Busine, who is in charge of a very interesting technology on disease reporting, because we are in Westlands, but we are able to scope what is happening in the continent as far as disease reporting and response is concerned. If you allow, Hiba Busine probably could give us a highlight on that, and then other colleagues could also mention on some of the other technologies and innovations we are using to address animal health.
Thank you. Hiva, please, but be brief, please.
Yes, yes, no, I will be brief. It's that one of the key achievements that for AU-IBA after the eradication of rinderpest that Henry talked about is the development of the animal resource information system. This was based on the recommendation of the ministerial meeting in 2010 and AU-IBA. That's this, the ministerial meeting instructed AU-IBA to develop this animal resource information system. And this system has been now developed and rolled out in all the member states, not all, almost all the member states, around 50 member states out of 54 member states in Africa. And it's customized to adapt to the national, to any country, and then to the country, and from country to the regional economic level up to the continental level, to share. It is to share to share information and collect data on animal, not only on animal health, but also on animal production, fisheries, bees, among others. And it is the system is operational and functional in most of the countries, as I mentioned. It is now currently being upgraded, and soon AU-IBA will embark on building capacity of member states to successfully use the system. And from the and now this is now being used for immediate notification of any sanitary event from member state through ARIS system, as well as also submitting their monthly animal health disease report. And discussion is ongoing to link AU-IBA system to OIE WISE, what's called the interoperability, so that to facilitate the work of the national epidemiologists, so that when he key in any disease information at the national level, it can both be received at AU-IBA and OIE level. Thank you.
Thank you very much, Dr. Bosini. Anyone else who wants to contribute briefly on the same?
Yes, thank you, Philip. I think, the question on technologies, what technologies are used, AU-IBA itself does not carry out testing, if you like, or, use technologies in laboratories and so on. But through the rinderpest eradication process, AU-IBA, together with partners, FAO, OIE, and also the International Atomic Energy Agency, was instrumental in the evolution of the testing capabilities in African laboratories, from traditional tests such as complement fixation test, virus neutralization test, and so on, to the introduction and use of the enzyme-linked immunosorbent assays, or ELISA testing. That was in the 80s and 90s. And the rinderpest eradication process also saw the introduction of the polymerase chain reaction, PCR, for the diagnosis of rinderpest. Yeah, and now PCR is widely used across the continent in many African laboratories for both diagnostic testing and also for epidemiological surveillance, where you can more precisely now tell the interrelationships between the causative agents of diseases in different locations. once you isolate them and you carry out the molecular diagnosis and sequence analysis, you can be able to determine that this particular virus is related to, or bacteria is related to one that caused an outbreak in another country. So AU-IBA has been very instrumental in that evolution of diagnostic testing, to modernizing diagnostic testing. Thank you very much. Over to you, Philip.
Thank you very much, Dr. Omwahi. Anyone else? If there's no one else, I would like to give each of you 1 minute to give their closing remarks as we come to the end of this conversation. And for those of who have been joining us through our social media platforms, you can continue sending your questions on that platform, and our panelists will continue even after this webinar. We'll still give feedback on some of those questions. Maybe I'll start with Dr. Annie. Please give us your closing remarks, less than a minute.
Okay, thank you very much, Philip. I just want to, my closing remark, I want to apologize to our participants for the small technical hitch that we had this morning, and we're not able to start on time. So we are genuinely sorry. It is a world of technology and anything can happen anytime. I still want to mention something about One Health again and COVID-19, Philip. I want to emphasize the fact that COVID-19 is still a mysterious disease. And if I would rank it, I would not give it 99% zoonotic nature. I don't think it's even 1% zoonosis. So that's why I think it has taken a lot of organizations' time to get the right approach to multi-sectoral approach kind of a thing. At the moment, it is still to me 99.999% human disease. And I want to draw your attention to year 2004. We had a disease called bird flu or avian influenza. I think you remember it was very, very zoonotic. It was actually 100% zoonotic. And it came from the same path. It followed the same path as COVID-19 from China to Europe and to Africa. And it was transmitted by migratory birds from China, Europe to Africa. And the AU-IBA with partners came up with a project called Support Program to Integrated National Action Plans that really handled the disease, and the plans helped countries to either control where it had already infected or to prevent its invasion. So we have a lot of tools that if we were sure COVID-19 was zoonotic, we still have tools from bird flu and other tools as well that actually can be used to respond to COVID. And we are still thinking about COVID, but the challenge is that we are not sure it is zoonotic. Thank you.
Thank you very much, Anne. Let me go to Henry Wamai. Dr. Henry Wamai, please give us your closing remarks.
Okay, thank you very much, Philip, and I thank the Standard Group for availing this opportunity and taking us very ably through this webinar. But I'd just like to say that surveillance for disease is critical to prevention, to control, and eradication. Because if you don't know what you have, then how can you control and eradicate? And to paraphrase it all, I'd just like to quote Thomas Jefferson, a one-time president of the United States, who said that the eternal vigilance is the price for freedom. And this applies equally to disease management. We must be on the lookout all the time. Thank you very much. Over to you.
Thank you very much, Dr. Wamai. Let me go to John Opong. Please, John, give us your closing remarks.
Thank you, Philip. There are two, one on AMR, one on standards. So for the farmers in our midst, we encourage you that you seek the services of a veterinarian or the appropriate professional, a para-veterinarian, before you administer antimicrobial on your animal. This will go a long way to mitigate the harmful effect of antimicrobials. And to all of us, if you are sick, please seek medical attention first. Don't self-prescribe. Get to the doctor and let the clinical diagnosis be the determinant for you using a particular antimicrobial. This will help save this scarce resource that we have. On the question of standard, what I would want to say is that trade is driven by standards. Standards are important for protecting all of us, but we need to demand for higher standards. That is the only way that we can protect our consumers. So all of us are consumers, and I urge all of us, let us place demand on the market by requiring higher standards for our produce. And by so doing, we will not only protect ourselves, but we will also facilitate trade within the continent and with our partners outside of Africa. Thank you very much, Philip, and thank you to the audience as well.
Thank you very much, John. I will go to Dr. Hiva Bossini. Please give us your closing remarks.
Thank you, Philip. For my closing remark, I have 2 points. The first one is a call for the effective implementation of the animal health strategy for Africa. As mentioned, it is a framework for really delivering a sustainable animal health system in Africa that meets really OIE standard and other international animal health standard, and to call all the partners, the African Union institution, the regional economic communities, and especially the member states, really to adopt and initiate the implementation of the animal health strategy for Africa as an integrated and holistic approach for the improvement of the animal health system in Africa, given the impact of animal disease on the competitiveness of animal resource value chain, the increasing risk of emerging and re-emerging zoonotic diseases, climate change, inadequate environmental management, civil strife and conflict that Africa is experiencing. The second one is just to say that AU-IBA, yes, is one of the technical institutions of the African Union Commission in charge of animal resource development, but we are not working together. We have other AU institutions that are playing key role in animal health as well as animal resource development across the continent. Let me mention that the AU PANVAC is the Pan-African Vaccine Center in charge of the control and diagnosis of animal diseases, even development of reagents for member states. And we have AU PATEC. This is the Pan-African program for Cheche and trypanosomiasis eradication campaign. You know, TRIPS also is a zoonotic diseases, sleeping sickness, and trypanosomiasis on animal health side. So this is the first webinar, and I'm sure that there will be a follow-up webinar where all the African Union institutions dealing with animal resource will be sitting together to respond comprehensively to all the questions from participants. Over to you, and I thank you all for your kind attention.
Thank you very much, Dr. Bossini. Last but not least, let's go to Professor James Bacha. Please give us your closing remark in less than a minute, please.
Thank you, Philip, for moderating this very interesting session, and our participants for participating. From the topics we have covered, it is very clear that animal health need to be approached from a very, very holistic angle, given the issues that need to be considered, issues of trade, issues of animal health, issues of public health, the contribution of animal health to productivity and economic development of countries. And what I would want to say from this discussion we have a tool, the Animal Health Strategy for Africa. And what I also want to say is that tools are there to allow us address issues of animal health. Resources, yes, are scarce, but what I would want to call on all our participants and ourselves is to try and think of innovative partnership models. Resources will always be scarce, but if we all work together, if we try to exploit our different energies, our different capacities, create the necessary partnerships and synergies, we will be able to improve the status of animal health in the continent and therefore enhance the contribution of animal resources sector to the well-being and prosperity of the African people. Thank you.
Thank you very much, Professor. That is it for this webinar today. And as earlier, Dr. Annie Leo had earlier apologized, I will also want to apologize on behalf of the Standard Group for the earlier technical hitches that we had. And but we are very grateful that this conversation has happened. We've had very fruitful conversation, and indeed, animal health is a very critical issue that we all need to be talking about, especially for economies in Africa. And we want to thank the AU-IBA team for all you've been able to do. Until next time, that is it. Goodbye and thank you.
Goodbye. Thank you to all.
Goodbye. Thank you very much.
Bye-bye.
See you for the next webinar.
Yes.
Thank you, the moderator, for the work well done, despite
thank you.
Some problems at the beginning. So, but it's lesson learned.
Yes, Dr. Asante sana, Dr. Bosili.
Thank you.
Thank you.
So that this one will, it is recorded, and I think also we'll share to participants, those who are interested, if we have the mailing, the mail contact.
Yes, it is recorded.
Okay.
Okay.